Hey my nurse babes, it's your girl Brittany Kiss. Welcome to my channel where we keep it simple, sis, or sir if you're watching. So today I wanted to come to y'all and talk about something that I feel like is really important in the world of nursing. Whether you are a new nurse, a nurse that's been doing this for years, or somewhere in between. One thing that is absolutely crucial to the success and the longevity of your nursing career is going to be you learning to CYA. What does CYA mean? Cover your ah. I'm not gonna say the word, but I'll repeat it one more time. CYA stands for cover your ah, if you know what I mean. You really need to get in the routine of documenting what you do. In nursing school, they pretty much like drilled it into our heads that if it was not documented, it was not done. You could be the best nurse in the entire world, giving top-notch patient care. I mean, advocating everything that you could possibly do for your patient. But if you don't document what you've done, then, it's like nothing that you did was done. And you're not going to get kudos or credit for any of your work. So what do I mean by get credit? No, it's not like somebody's going to come around and tell you good job or whatever it may be. But in the event that something goes awry, which things happen in life, things happen in healthcare, even if you take all the proper steps and precautions and do what you're supposed to do. Sometimes things happen that are outside of your control. When things go awry, trust and believe that administration, whoever is in charge, is going to be looking for the reason for why things went awry. And oftentimes, unfortunately, the blame falls on the nurse. That's one part of nursing that is really disheartening to me, but it is what it is. What's going to save you in the end is you being proactive and covering yourself in your work. It's to protect you. Yes, it can be a little bit annoying, especially your focus is your patient. As nurses, we tend to be very caring and compassionate people. Even when we're fatigued and burnt out, our number one concern is our patient. So charting can get in the way sometimes of what you feel like you have to do, but you have to make time to do this. It is vital. If I could stress this to you, new nurses, maybe nurses that have been doing this for a while, that you're just getting, let's be honest, you might be getting a little bit lax, but when something comes around and they're looking to throw somebody under the bus, it's going to be your notes and your documentation that CYA. Cover your eye, okay? So I would hate for somebody to end up in a situation where now they're being blamed for something and their documentation does not support their case of what happened. So please, nurses, get in the habit of right after you do patient care, boom, go to your little computer and document what you did. I try to get in the habit of documenting as soon as possible. Some nurses will do a couple of things for a couple of patients and then they'll take an hour or however, maybe not an hour, because what nurse really has an hour of free time to just sit there and do something? But they'll take a little bit of time and then they'll just go back and do everything they maybe did in the previous hour. But if that works for you, that's fine. But I would encourage you to get in the habit of documenting what you do as soon as possible to the time that you did it. Now, there are some cases where there's emergency situations and just ish has hit the fan and all you can do is focus on your patient care. Yes, go ahead and do that as soon as things smooth out, even if it means that you have to stay a little bit past maybe your shift to get your charting done. Look, I'm telling you, if you don't protect yourself, nobody else will. And especially if it's them or you, best believe they're going to be coming at you. I've seen situations where the best nurses who I know give top-notch quality care have been thrown under the bus for something that I know they probably did not do or that they didn't deserve to go down for. And unfortunately, their charting or their lack of charting was not there to defend them when they needed it. All right. So if I can give you nurses a bit of advice for 2020, go ahead and get in the habit of making sure that you document. If it wasn't documented, then it wasn't done. period. Okay? All right, y'all. So I hope y'all have a wonderful rest of your day. Be blessed. Remember, this year 2020, we got a fresh start. Go ahead and just go after your goals, your dreams, your visions. Let's be intentional and focused this year, y'all. I have so many things in the works that I can't wait to get back to y'all on. So I'll see y'all in the next video. If you like this video, please go ahead and subscribe and give me a thumbs up. All right. Till next time. Be blessed.